among practitioners who are not well equipped with dental traumatology. So avladhan idu, okay. So I'm not going to go into how to manage la pomata, enna prachana, how you can solve it, okay. That's all. So all of you must have seen this movie, yes? No, Hangover paatadillaya? பிடிக்காது எப்படி சார்? They all go on a trip. So that I love that movie, by the way. It's something which we all aspire for. Okay, that's men, but ella girls onna saying the girls only trip, we go, we have fun, come back, but not like this, okay. So idu enna nadakkum, I don't know if you all have seen the movie, you would have understood that the guy, he himself pulls his teeth off under influence, okay. So avare adha eduthupar. So this is an extreme case of dental trauma, but let me warn you, நீங்க வந்து when you deal with kids, you will see bizarre cases of dental trauma. இதெல்லாம் ஒண்ணுமே இல்லை, இன்னும் நிறையலாம் பார்ப்பீங்க நீங்க. அண்ணன் தம்பிக்குள்ள நடக்கிற அந்த குட்டி குட்டி சண்டையில what all you can see, So let me tell you, like even if you are a general practitioner who is practicing in some remote corner of the world, trauma can hit any time. And as responsible dentist, நம்மளோட readiness definitely matters. ஏன்னா ஒவ்வொரு வாட்டியும் when a small delay happens in treating a traumatized tooth, the longevity of the tooth is coming down, right? So நீங்க எவ்வளோ ரெடியா இருக்கீங்க அப்படிங்கிறது extremely matters. So what makes you ready? Knowledge, infrastructure and expertise, right? So knowledge, yes, there are a lot of CDE programs going on, lot of guidelines and all that. So என்னோட role என்னன்னா to introduce you to those guidelines. எங்க இருக்கு, எப்படி இருக்கு? So that is my role here. So infrastructure, yes, there is nothing much needed, okay. It's whatever you have is very cool. All you probably need is some bioceramic material for most of the cases. Other than that, பெருசா ஒன்றும் தேவைப்படாது. ஒரு ligature wire, கொஞ்சம் composite. So nothing much, okay. Expertise comes as in when you start treating, when you don't shy away from such cases, expertise comes in. Okay, so that is where the readiness comes in. So having said that, now these are two studies from our area. So one is a North Indian study which says that no, readiness is not there, okay. Say North India la dhaan appadi irukku. Now South Indians are generally considered to be adept, right, in dentistry. Paatha idu நம்ம பக்கத்துல சவிதால பண்ண ஸ்டடி தான். No, South Indians are, again, they are also not so ready. So these are all like proven studies, okay. So therefore, இன்னைக்கு content na pitfalls and their prevention in diagnosis, as I was saying, in management and in follow-up. So even if you do a good diagnosis, a perfect management, if you're not following up the tooth, if you're not following up the patient, usually the attrition in follow-up is very, very common. But if you do not have a robust system to handle that, there is no point in you doing a good management. So in the point, that is follow-up, documentation is also very, very important when it comes to trauma. So first coming to trauma, diagnosis. First diagnosis is step enna? Taking history, right? So what happens? So idella you all know how to take a history. So I'm not going to say what, but enna points that we generally are being missed. அதுதான் இங்கே எழுதியிருக்கேன். ஃபர்ஸ்ட் திங் இஸ் எக்ஸாக்ட் டைம் ஆஃப் இன்ஜுரி எழுதுறது கிடையாது. வென் பேஷண்ட் கம்ஸ் இன், ஓ அடிபட்டுச்சா, எப்போ அடிபட்டுச்சு, அந்த எப்போ அடிபட்டுச்சு ஷுட் பி ரெக்கார்டட் ஆஸ் அண்ட் வென் இட் ஹேப்பன்ட். இஃப் தே சே லைக் 16 ஹவர்ஸ்னா 16 ஹவர்ஸ், 18 ஹவர்ஸ்னா 18 ஹவர்ஸ், டே பிஃபோர் எஸ்டர்டே, 2 days before, 2 weeks before. It should be recorded. Exact time of injury matters. Why do you think it matters? Why do you think matters the exact time of injury? Yeah, treatment plan, your pulpal status, everything depends on the exact time of injury, where it happened, how contaminated was it. So that also happens. Did it happen in a non-contaminated area? What happened after the injury? What is the medical status of the patient? Is he under a tetanus shot or tetanus shot kuduthacha? என்ன மெடிக்கலாக என்ன பண்ணியிருக்காங்க? ஸோ ஆல் தோஸ் அண்ட் த பேஷண்ட் டஸ் இட் ஹேவ், இஸ் ஹி a special child, is he under any other kind of treatment? எல்லாமே is important, okay. So these kind of things are usually overlooked when history is being taken, okay. So let me tell you, so for you to make a diagnosis on history தான் it forms a 70% of the data comes from the history. Say for example, இந்த இதில் it's very easy for you to say the time of, இதை பார்த்தோன்னே உங்களுக்கு தெரிஞ்சிரும்ல, how bad is the injury, you can say. How long did the injury happen? எப்போ, you can easily say it. It's a very old injury, பார்த்தாலே தெரியறது இல்லை. So there is nothing much to, but let me ask you, either looks pretty fresh, right? This one, that also looks pretty fresh, right? But idhula oru difference irukku. The first one, the first picture I said, this was within 24 hours, whereas that is 4 days old. Though it looks very similar, you should know that there is a difference, okay? So on the time of injury matters. Idukku adukku nadula probably management la there might be a difference. Though it looks very similar, the management part will differ. So நீங்க பார்க்கிறது மட்டுமே கிடையாது trauma, proper history taking is extremely important. So for that, one easy way is following a checklist, okay? So this checklist is AAPD oda reference manual la irukku. So you can just go there, it's just a 2-page checklist or a case history kana 2-page da, just you can have it in your clinic. So as and when you have a trauma patient walking in, take some time, start filling this out. So enga department neenga vandingena, we have some 5-page trauma history, because that much amount of information is needed. So that is something which we have curated over a period of time. 5 pages irukum, and every student is supposed to fill those 5 pages, not leaving anything. So that is something which we have learned through experience, okay? Every single data matters in trauma. But idu appilla illa 2 page da, but these are the bare minimum details which you should need when you are handling trauma cases. So AAPD la idu neenga download pannikalam. So the next thing is incomplete clinical examination. Now when I say incomplete clinical examination, it's I mean that particular tooth is an extruded tooth, right? It is out, உங்களுக்கு clear-ஆ தெரியலன்னு நினைக்கிறேன். It's slightly outside the occlusal line. It's an extruded tooth, okay? But if you look at it very closely, the color of the tooth is also a little off, right? கொஞ்சம் discolored-ஆ இருக்கு. But when it comes to primary tooth, this discoloration does not matter, okay? Discolored primary tooth na, you need not be enthusiastic about it and go and do a pulp canal, root canal la panna thevilla. But what it says is there is something else other than extrusion that has happened in that tooth, right? At least you can sense that, right? Anga enna nadandirukna, there was a history of previous trauma. So that probably the mother would leave it. அம்மா சொல்ல மாட்டா, இப்போ விழுந்துட்டா அப்படின்னு மட்டும், பல்லு கீழே விழுந்துச்சு மட்டும் தான் சொல்லுவாங்களே தவிர, ஒரு 2 வருஷம் முன்னாடி ஆல்ரெடி அங்கே அடிபட்டுச்சு, probably a small subluxation happened or nothing else happened, the child was fine, the mother would have forgotten. So always go for a thorough clinical examination, okay? Most left out என்னவா இருக்கும்னா luxation injuries. ஒரு பல்லு வருது, ஒரு enamel fracture, dentin fracture, easier you will take it up. But luxation injuries are the most commonly missed. So always make sure that you do not miss out on any luxation injuries, okay? Again, soft tissue injuries, there will be okay, or a class 2 fracture irukku, enamel dentin fracture irukku, கீழே பார்த்தா lips will be lacerated, but நம்ம அந்த lips கவனிக்க மாட்டோம், ஒரு ointment எழுதி அப்படியே விட்டுருவோம். But what would happen is there will be a missing piece of the tooth fragment embedded in that lip. So always make sure, if at all you have a laceration, just palpate it, go for an IOP, soft tissue IOP எடுங்க, அதில் fragment இருக்கான்னு பாருங்க. So do not leave out any, even if there is a frenulum tear, do not leave any soft tissue injuries also. Treat the whole mouth, I mean, as a whole, okay? So what do you see there? Crocodile. Yeah, it's hiding, right? Yes. So it's seemingly a safe environment, but you have something, a danger lurking there, right? So இது வந்து நம்ம அப்படி மேலோட்டமாக பார்த்து காலை கொண்டு போய் உள்ளே விட்டோன்னா அவ்வளோதான் காலி. So something similar to that is your injuries, okay? So usually என்ன நடக்கும்னா, ஒரு crown fracture tooth, even if there is no pulpal necrosis, let's say just நான் சொன்ன மாதிரி just a Ellis class 2 fracture, you know what is class 2, right? Enamel dentin மட்டும்தான், you hardly expect any kind of pulpal necrosis to happen. But if at all there is a concomitant injury, if at all there is a luxation injury, அது ஒரு subluxation-ஆ இருக்கலாம், lateral luxation-ஆ இருக்கலாம், any kind of luxation injury, your chance of pulpal necrosis is going to increase. So always make sure whenever you have a, ஒரு seemingly ஒரு சேஃபான ஒரு இதா இருந்தா கூட, go look for your periodontal injuries, okay? Do not miss on them, okay? So for example, இப்போ இந்த photo பாருங்களேன், you can see that it is just a enamel and dentin fracture, pulp is not exposed, there is no kind of the patient did not have any mobility, nothing, no pathology, nothing was there, okay? But interestingly, when we took radiograph, this is what we found. Can you see there? A root fracture. So, but the pallu was not mobile, the tooth was not at all mobile, okay. So, always make sure, and that too, see, whenever you take radiograph, make sure you take it in more than one angle, okay. You might miss something on one particular angle, so take more than one angle, okay. So, basically, neenga enna pannuna, always try following a guideline, okay. When you have a guideline stuck to your clinic wall, list out the clinical features, list out the history, try arriving at a diagnosis based upon the classification. You are safe enough. Okay, so that is one simple tip which you can do. Okay, so like I was saying, the pulp vitality. Number clinic la enna pandrom? What is the most common pulp testing that you do? Do you do pulp testing? Yeah, yeah. Good. I'm happy. Enna pannuvinga? Enna pulp testing? Cold test. Yeah, super. Yeah, cold test is better when compared to heat test or electric pulp test. Cold test is better. But again, cold test number enna paakrom adula? Are we really truly checking the vitality of the tooth? No, right? What are we checking there? Nerve conduction. Yeah, nerve conduction. So vitality check pannona enna venum namakku? Exactly. You need something like laser Doppler flowmetry, or you need a pulse oximeter with some specialized connection that can be placed on the tooth. You need all specialized instrument which none of us have. So the easy method is cold testing, but you should always remember that we are not testing exactly the vitality of the tooth, we are checking only the nerve conduction. And nerve conduction, right after the trauma, the tooth can act stunted, and appa edukra pulp vitality is not real, okay. So you have to wait. Appa edukra pulp vitality vechu, okay, non-vital, abdi ezhidittu immediately open the tooth, remove the pulp, no. You have to keep repeating the pulp vitality minimum of 2 to 4 times varaikum kuda neenga pulp vitality check pannalam. Let's say the patient comes to you with an alveolar fracture. Okay, alveolar fracture neenga ellathiyum ulla vechu, you have splinted it beautifully. The tooth will react non-vital for a minimum period of 4 weeks. 4 weeks, sometimes even to a period of 4 months kuda non-vital act pannom, but the tooth might not be non-vital. So always have caution before you enter the tooth canal, okay. So only if there are, okay, repeated long prolonged period of time the tooth is showing signs of non-vitality, or a sign of non-vitality. Discoloration is not a sign of non-vitality. Again and again I iterate, okay. Discoloration is not a sign of non-vitality. If you find any swelling, if you find any abnormal mobility, if the patient complains of pain, then you will go and open the tooth, okay. So yes, so idellatha vida romba mukkiyam vandu photographic documentation. How many of you do photographic documentation? Good. Anybody else? Of all trauma cases? Yes, that is great. So photographic documentation is extremely important, okay. So basically enna, first vandu it's for medical legal purposes, okay. Any trauma case இன்னைக்கு சொல்லுவான் இது MLC இல்லன்னு சொல்லுவான், நாளைக்கே வந்து சொல்லுவான் இல்ல இது MLC, that you will not know. It has happened many times to us. We treat the kid as a non-MLC case. After 2-3 weeks you will find a police coming in. இல்ல அது MLC தான், அவங்க அப்பா அப்படி சொன்னாங்க, இப்போ மாத்திட்டாங்க, அவன் அடிச்சான் இவன் அடிச்சான். So always photographic documentation should be a must for any trauma case that comes in, okay. Because இன்னைக்கு இப்படி நினைப்பாங்க, நாளைக்கு வந்து மாமன் தான் அடிச்சான், ஆனா மாமனோட சண்டை கிண்டை, that all that will happen, okay. That is one thing. Second, as I said, tooth discoloration. நீங்க வரும்போது tooth discolored இருக்கலாம், இல்ல tooth discolored இல்லாம இருக்கலாம். So how is the tooth developing? What is the state of the soft tissue injuries? If at all the tooth has gone into intruded tooth abdina, how fast is it coming out? So all this you can monitor, and you can keep the patient informed by your photographic documentation. So photographic documentation is extremely important. History taking is extremely important. So having said all this, history, photographic documentation, radiographic examination, and coming to a proper diagnosis. So idellathukku easiest method enna, for you to go to a website called International Association of Dental Traumatology. Go to that website, there are guidelines there, okay. So on the guidelines, if you have it, take a printout, stick it in your clinic, okay. So just do a proper history taking, note down what are all the clinical features, and form a proper classification, okay. So then you will have a proper diagnosis that is made, especially for pediatric cases. So now coming to management, again management, as I say, I am not going to tell what is the management for this case, what is the management for that case. We are only going to talk about what are all the common mistakes that happen during management phase. So first, ungalku ella theriyum enamel fractures enna pannum, you know, right? What is the treatment plan for enamel fractures? I don't find anybody making a mistake there. What is the treatment plan? Enamel fractures, just enamel fractures. You either do an enameloplasty or you do an aesthetic restoration, right? So we are done with that. Enamel and dentine fractures? Yeah, aesthetic restoration, some amount of pulp protection if it is a bit deeper. But let me tell you, enamel and dentine fracture, you have to keep the patient under follow-up. ஏன்னா அந்த coronal restoration போயிடுச்சுன்னா என்ன நடக்கும்? Yeah, the patient will be asymptomatic for a long time. திடீர்னு ஒரு வருஷம் கழிச்சு the tooth will become non-vital because the dentinal tubules were open. Okay, so always remember that whenever you have dentine exposed, make sure the patient is kept under follow-up. Okay, so any dentine exposed is a critical situation now, and whatever restoration you are doing might fail. So always keep under follow-up. Now, where the things have changed is from complicated crown fractures onwards. Now, complicated crown fracture is what? When the pulp gets involved, right? So initially, when the pulp, we were all over treating the tooth. Pulp involved ஆயிடுச்சு அப்படினாலே we were rushing to do an RCT. We were rushing to take out the pulp. But right now, what we have there, the pulp, it's a பயங்கரமான ரிச்சான ஒரு organ. Okay, it has got beautiful undifferentiated mesenchymal stem cells that can heal anything. Okay, so we are relying so much now. இப்போதான் வந்து நிறைய studies are coming out. We are trying to understand the pulpal biology, how it works. So with our increasing understanding of pulpal biology, what we are advocating is நிறைய எல்லாம் பண்ணாதீங்கப்பா. Treat minimally. Okay, the pulp will take care of its own. You need not over treat. You need not go that extra mile to remove all that. Let the pulp heal on. So what is more important there is you keep the infected pulp or you keep the pulp, the healing pulp, separated from the outside environment. That is very, very important. So what is important there is your coronal restoration. Okay, so coronal restoration nalla koduthittu you need not over treat the pulp. So that is where the consensus has changed. Okay, so that's where the guidelines have changed. So preserving the pulp vitality is our goal whenever the pulp is involved. Okay, so whenever the pulp gets involved in any trauma, our first consensus will be to preserve the vitality of the pulp. So you can do that either by direct pulp capping, your pulpotomy, partial pulpotomy only when it is needed, and there is one exception in this is whenever you need a post-endo restoration. Okay, whenever you need to, because as I said, coronal restoration is extremely important, right? So ஒரு post-endo restoration தேவைப்படுது அப்படின்னா மட்டும் go for an RCT because you will want to do a post-end core or something, then you can go for an RCT. Other cases, if you can save the pulp, try saving the pulp. Okay, say for example இப்போ in this situation you can do direct pulp capping. So direct pulp capping is when you know when it is done, right? When there is a pinpoint exposure few hours after the trauma, you can do direct pulp capping. It has got beautiful success rate. Okay, so now this is again you can see that there is a pinpoint exposure there. So we did direct pulp capping there, a proper restoration was given. Okay, and you can keep the patient under follow-up. So now this particular case, okay, now I'll ask you, what would be the treatment plan for this? X-ray. That's very brilliant. Okay, he's not coming to a diagnosis without the X-ray. I am liking it. So tell me, what would be the treatment plan for this?
Vitality testing?
Yeah, vitality was vital. The tooth was vital.
Okay.
Pulp capping, yes. But there is one problem here, right? I was talking, right? If at all, tooth structure is very minimal, right? So we have to think about the post-endo restoration also, right? But again, there is another catch there. If you see at the radiograph, can you see an open apex there? So now the question is, what should be my first goal be? அது ஒரு கொஸ்டின் வருது, நான் வந்து அந்த எபெக்ஸ் க்ளோஸ் பண்ணுறதுல கான்சென்ட்ரேட் பண்ணுமா இல்லை வந்து நான் RCT பண்ணி பல்ல சேவ் பண்ண போகிறேன்னா? Yeah, first thing is you are going to do something to allow the apex to grow physiologically. Tooth is vital. அப்போ என்ன ட்ரீட்மெண்ட் பிளானாக இருக்கும் உங்களுக்கு? Yeah, pulpotomy. Okay, pulp capping won't be. So we did a pulpotomy in this tooth. So pulpotomy முடிஞ்சோடனே we will wait for the apex to close. Okay, only after ஏன் நம்ம எடுத்தோடனே இதுக்கு வந்து ஒரு எபெக்சிஃபிகேஷன் பண்ணியிருக்கலாமே? The question would be that, right? எபெக்சிஃபிகேஷன் பண்ணியிருக்கலாம், இல்லை வேறு ஏதாவது ஒரு மெத்தடில் அந்த எபெக்ஸ், we only need the apex to close, right? Why are we even doing a pulpotomy, waiting for the apex to close and then going for a post-endo restoration? Can you just tell me why? Physiologically formed அந்த dentine இருக்கு இல்லையா, it's much better than anything that would be formed by epixification or anything. So first of all, give preference for the either. So this is one situation where the thing slightly changes, okay? Immature root. So next question on the sex pulpotomy, the partial pulpotomy. எல்லாரும் கேள்விப்பட்டிருப்பீங்கல்ல partial pulpotomy. Now initially என்ன பேசிட்டு இருந்தாங்கன்னா, whenever there is a trauma, if the patient comes to you within 24 hours, 48 hours, we consider okay pulp வந்து கம்மியா infect ஆயிருக்கும், so we can do a partial pulpotomy. Right now, I'm only telling you whatever has changed, okay? Whatever is there in the books உங்களுக்கு already தெரியும். So whatever has changed. So even up to 9 days, ஒரு trauma நடந்து pulp expose ஆகி 9 days வரைக்கும் you can do a partial pulpotomy. So that is what has changed. So if the patient comes to you in the 6th day, 7th day, நீங்க பார்க்குறீங்க, like I showed you a picture, right? The pulp ஒரு கொஞ்சம் hyperplastic மட்டும்தான் ஆயிருக்கு, but the pulp is quite fine, vital இருக்கு, but the patient is telling you 9 days trauma history சொல்றாங்க. So don't go ahead and do a pulpotomy. You can stop with partial pulpotomy. அந்த ஒரு 2 to 3 mm of pulp மட்டுமே எடுத்துட்டு கூட you can just save the tooth, okay? Say for example, this particular patient we did a Schweck's pulpotomy தான். So இதில் என்ன அட்வான்டேஜ்னா, there was an open apex also, okay? So open apex வந்து automatically it gets closed with all this, okay? With all this Schweck's pulpotomy and all. So இதில் எல்லாத்துலேயும் most important thing as I was saying is only one thing. நீங்கள் என்ன பண்ணாலும் சரி, whatever heroism you do within the tooth, outside the tooth, there is only one thing that can help save your tooth. That is your coronal seal. இந்த மனுஷன் தான் கடைசியில் நின்று காப்பாற்றுவான், okay? When everything comes. இந்த படமாச்சும் பார்த்துருக்கீங்களா? இல்லையா? Seriously man, Avengers பார்த்தது இல்லையா? I'm going to cry out loud now. I love movies, so என்னோட எல்லா டாக்லயுமே movies will be there. Right from கவுண்டமணி ஜோக்ல இருந்து ஆரம்பிச்சு எல்லாமே இருக்கும். So I'm going to cry here because you don't know Avengers. அதான் அயன்மேன்லாம் தெரியலன்னா எப்படி? அயன்மேன் தெரியும்ல? Yeah, we all cried when that fellow died in the end. So finally, yes, if you're going to say Iron Man, you are going to remember only this, okay? Coronal seal. So an effective coronal seal is very, very vital, whatever be the procedures you have done, okay? So next area, or gray area, is the root fracture. So what will you do when there is a root fracture? Stabilize, right? First of all, you have to stabilize the tooth. So whatever initially was thought has changed slightly, okay? So enna nadakudana, the coronal fragment, even if you say if you have a loose coronal fragment also, or cervical level of fracture nadakudhu, the coronal fragment is loose, even then try saving the tooth, okay? Even if it is mobile, splint பண்ணுங்க, 4 weeks வரைக்கும் splint பண்ணுங்க. If it is a cervical fracture, cervical fragment complete போயிட்டுனா, you will need longer period of stabilization. Even then it is okay. You need not extract the tooth, okay? Because the coronal fragment always has a potential to heal. Simply because if you see the coronal fragment, அது எப்படி இருக்கு பார்க்கிறதுக்கு? Apical fragment, leave it. Apical fragment ஒண்ணுமே நடக்காது. It will not even get infected. Apical fragment is quite safe there. Our concern is only about the coronal fragment. But when you see the apex of the coronal fragment, it will act as an immature tooth. அப்படி தெரியுதா உங்களுக்கு பார்க்கிறதுக்கு? அந்த apex வந்து ஓப்பனா இருக்கிற மாதிரி இருக்கா? So that is our understanding. This coronal fragment can act like an immature tooth and it can heal itself. So உங்களோட treatment plan எப்படி இருக்கணும்னா, first to stabilize the root fracture, and then அந்த கீழ இருக்க fragment you are going to treat it as an immature tooth. So sometimes என்ன நடக்கலாம், spontaneously the vitality can come back because it's open. We consider it as an open tooth, okay? அப்படி நடக்கல அப்படினா, then you will go for root canal procedures which is similar to an immature tooth. Epixification, something like that you can go. So whenever there is a root fracture, இந்த மாதிரி root fracture இருந்தா கூட do not extract, right? Now you will ask me a question, what if it becomes, it is extremely mobile, அப்ப or it is extremely comminuted, ரொம்ப crush ஆயிருக்கு, அப்பனா மட்டும் extract and then you can surgically bring down the apical fragment, okay? And you can do post and whatever. Your endodontist can come in and they can do some post, or surgically they can bring it down, endodontically they can bring it down, endodontic post or orthodontically. So that will be the last resort. So initially root fracture na stabilize பண்ணுங்க, even if the coronal fragment is very mobile. See, all this I am talking from IADT guidelines, okay? The recent guidelines which is like formed after so நிறைய studies வந்ததுக்கு அப்புறம் தான் these guidelines have been improvised. So I am talking from literature. So coronal fragment extremely mobile இருந்தா கூட stabilize it for longer periods. Do not think it's 4 weeks முடிஞ்சா நான் கழட்டணுமே நினைக்காதீங்க. Stabilize பண்ணுங்க and treat your coronal fragment as an immature teeth. Yeah, keep it out of occlusion. That is given. And that is okay. That gap எப்படி இருக்கும் root fracture எப்படியுமே அந்த gap இருக்கும் இல்லையா? There is a small cut will be there, no? Yeah. அது உள்ள தானே இருக்கு. அது ஒண்ணுமே ஆகாது. Okay, this is what I have told. So, one point which I want to tell you is, in any kind of treatment, do not start your endodontics immediately, okay? So, the முன்னாடிலாம் நம்ம நினைப்போம் இல்லையா, necrose ஆயிடும், resorption நடக்கும். So, முதல்ல நம்ம வந்து we'll remove the pulp, we'll give some intracanal medicament, we'll stop the necrosis process. No. Any kind of luxation injuries, any kind of root fracture, do not start your endodontic treatment. Allow the pallu to heal, okay? It is already under so much of stress. Our idea is to allow it to heal, so give it time. 2 weeks வரைக்கும் நீங்க வெயிட் பண்ணலாம். Unless and until the patient shows extreme signs of non vitality, ரொம்ப பெயின்ஃபுல்லா இருக்கு, ரொம்ப முடியல, அப்படி ரொம்ப high signs of disturbing signs of non vitality இருந்தா மட்டும் தான் you are going to attend it. Otherwise you can wait. You can wait for 2 weeks, allow the PDL ligaments to settle down, and then you can go for endodontic treatment, okay? So this was again a root fracture, as I said, on the apical fragment. Then this, okay? So now coming to luxation injuries. Luxation injuries you all know, right? Adu na solradhukku perusa edume illa, nothing has changed much in it. So basically again luxation injuries la enna difference na, we are not going to do an endodontic treatment immediately, okay? So எது வந்தாலும் ஸ்டெபிலைஸ் பண்ணிட்டு எதா இருந்தாலும் பாத்துக்குறோம், 2 வாரத்துக்கு அப்புறம் தான் நம்ம பாத்துக்குறோம், okay?
Fracture segment வந்து mobility இல்லனா you can leave it as
no need to stabilize. If it is not excessively mobile, stabilize பண்ணனும் கூட அவசியம். Talking about root fracture தானே சார்?
partially extrude ஆக ஆரம்பிச்சிச்சுனா in case this fragment is
அப்ப நீங்க வந்து you can put it inside with a small digital pressure and then you can splint it. If it is no, it doesn't happen. அந்த மாதிரி நடக்காது. இல்ல அந்த மாதிரி நடக்காது. That is not going to happen. If in case you find if it's coming down because of a pathology, அதனால வருது அப்படினா you can initiate your endodontic treatment, you can splint it. If it's becoming mobile because of a pathology, அதுதான் நடக்க வாய்ப்பு இருக்கு. So then you can initiate your endodontic treatment, you can splint it. So now lateral luxation, again lateral luxation வந்து இருக்கா கேக்கலையா கேக்கலையா இந்த பக்கம் okay, so lateral luxation again அதே மாதிரி தான். So we are going to think again in two things, okay? One, whenever there is a PDL injury, we are going to see if it is immature, if it is mature. So your treatment plan is going to differ for immature teeth and mature teeth, okay? Immature teeth na என்ன இருக்கும்? So any kind of PDL injuries, you are going to splint it, okay? So there is no doubt in that. You are going to splint for minimum of 2 to 4 weeks. That is okay. But in case of immature teeth, என்ன நடக்கும்? Yeah, you will have spontaneous revascularization நடக்க வாய்ப்பு இருக்கு. So even if the pulp is going to respond to your non-vital, wait பண்ணுங்க. 2 weeks, 4 weeks, 6 weeks, do not go enter, okay? Spontaneous revascularization நடக்கும், even in case of lateral luxation, okay? Only if it's a mature tooth, 2 weeks க்கு அப்புறம் 3 weeks க்கு அப்புறம், if you find the tooth is developing symptoms of non-vitality, you are going to do an endodontic treatment. So that is the only difference that is, before முன்னாடி இருந்த guidelines க்கு இப்ப இருக்க guidelines க்கு, okay? So intrusive அதே மாதிரி தான். Any kind of PDL injuries, always group the your diagnosis into two, mature, immature, because அப்பதான் வந்து there is the only difference that happens. Okay, intrusion என்ன, what we do? Intrusion, we observe, right? We wait and watch. So in the wait and watch, எவ்வளவு நேரம் பண்ணலாம், எவ்வளவு வரைக்கும் பண்ணலாம், that is there, okay? 4 weeks, no issues. You can wait. You have to monitor, but you have to call the patient every week and monitor, okay? So இப்போ ஒரு immature tooth அப்ப ஒரு 4 வாரம் வரைக்கும் வெளியில வரல அப்படினா, you can start orthodontic repositioning, okay? So mature tooth, but mature tooth வந்து இப்போ it should be only just 3 mm உள்ள போயிருக்கு அப்படினா, you can observe, wait. Mature tooth ஒரு 3 to 7 mm உள்ள போயிருக்குனா, orthodontically you can start repositioning. Above 7 mm, you have to go for a surgical repositioning. So this is based on the guidelines, okay? So immature tooth na, the 3 mm, 4 mm la கிடையாது, okay? You have to just time period தான். Immature tooth, you have to just wait for at least for 4 weeks. If அதுக்கப்புறமும் நடக்கலனா, you will start your orthodontic repositioning. And again, in immature teeth, spontaneous revascularization can happen, so do not enter the pulp, okay? Only if it is again நம்ம வந்து signs of non vitality காமிக்கிறதுனா you will start your endodontic procedures. Is that very clear? But mature teeth அதான் only 3 mm உள்ள போயிருக்கு அப்படினா வெயிட் பண்ணுங்க. எப்போ வந்தாலும் this is the treatment plan. டைம் பீரியட் அது மேட்டரே கிடையாது. எதுவுமே பண்ண தேவையில்லை. immature teeth வெயிட் பண்ணுங்க, அது வெளில வரும். immature teeth you have to wait, okay? mature teeth தான் 3 mm வரைக்கும் தான் safe. 3 to 7 mm start your orthodontic, 7 mm மேலனா surgical, okay? So root canal treatment வந்து intrusive மட்டுமே. If it's a mature tooth, this is where the difference comes in. Intrusive luxation is a very severe form of PDL injury, okay? So mature tooth இருந்துச்சுனா, again I'm stressing on that fact, if it's a mature teeth, do not wait for any non-vitality signs எல்லாம். Immature teeth இருக்கு, intrusive luxation நடந்திருக்குனா 2 weeksல you will start your RCT, okay? Do not wait and always use some steroid paste or some intracanal medicament, okay? Intrusive luxation மட்டும் தான் இந்த difference, okay? Because it's a very severe form of injury, 2 weeksல you're going to start your RCT. So avulsion, this particular slide is not for you, it's for your patients, okay? So இது எதுக்கு நாங்க சொல்லுவோம் அப்படினா, see for example you have a patient who's into sports, who's into contact sports. Generally அந்த மாதிரி ஒரு பேச்சுவார்த்தை நடக்கிறது, the mother is telling ஸ்போர்ட்ஸ்ல இருக்கான், or even if you find a small kid who is coming to your clinic, you can just freely இந்த advice கொடுக்கலாம், free advice, என்ன நடந்தா என்ன பண்றது அப்படினா. So basically you all know what to do, right? avulsion நடந்தா என்ன பண்ணணும் நம்ம எல்லாருக்கும் தெரியும். You're just telling them what to do. Mostly என்ன நடக்கும்னா avulsion வந்து இப்போ எங்களுக்குலாம் பேஷண்ட் வரும்போது people who come from very very deprived areas, rural areasல they think அந்த பல்லே வந்து ஏதோ விஷப்பல், அது வெளில வந்துட்டுனா அது விஷப்பல் தூக்கி போட்டுடுவாங்க. So they do not know that they can just put it in. So that is one thing. If you can practice telling the patients who walk in, mothers, if they are school teachers, all these people only make a difference in this, okay? So ஏதாவது ஒன்று நடந்துச்சு அப்படின்னா ஒன்றுமே இல்லை, அந்த பல்ல தூக்கி சாக்கெட்டில் போடுங்க, அவ்வளோதான். They did not do anything else. Just put the tooth back into the socket, bite on a handkerchief, bring to you, அவ்வளோதான். வேறு எந்த ஹீரோயிசமே தேவையில்லை. Only if that is not possible, milk, saliva, அது இதெல்லாம். Best thing is put it back into the socket, make them bite and get to you. So that is one thing. See, it's important to reimplant பண்ண முடிஞ்சா அதுதான் பெஸ்ட். ஒரு டீச்சரோ ஒரு கார்டியனோ anybody who can அந்த எமர்ஜென்சி சைட்லேயே ரீஇம்ப்ளான்ட் பண்ண முடிஞ்சு, ஜஸ்ட் rinse it, put it back, depending upon how contaminated it is. அது மட்டுமே அவங்க பண்ணா போகிறோம். மில்கில் வைக்கிறேன், சாக்கெட்டில் வைக்கிறேன், பக்கல் காட்டை இதில் வைக்கிறேன், அதெல்லாம் எதுவுமே தேவையில்லை. ரெஸ்ட் ஆஃப் த திங்ஸ் யூ கேன் டூ, ஓகே, when it comes in. So what would you do when the patient comes in? So நமக்கு எல்லாருக்குமே தெரியும், extra oral dry time less than 60 minutes you are going to reimplant. What if it is more than 60 minutes? Reimplant. More than 60 minutes. As long as your socket is patent, you can reimplant, okay? Do not bother எவ்வளோ நேரம் வெளியில் கிடந்துச்சு, ட்ரையாக இருந்துச்சா, வெட்டாக இருந்துச்சா, எதில் கொண்டு வந்தாங்க, கர்ச்சீஃபில் சுற்றி கொண்டு வந்தாங்களா, பேப்பரில் சுற்றி கொண்டு வந்தாங்களா, no. If your extraoral dry, if the socket is patent, if you can put it inside, just it's not like socket close ஒரு 7 நாளைக்கு அப்புறம் வராங்க socketலாம் க்ளோஸ் ஆயிடுச்சு, அதெல்லாம் இல்லை. If the socket is patent, if you can just put the tooth back in, do it, okay? Reimplantation is the best thing. So again இங்கேயும் அதே தான், closed apexனா you have to wait. முன்னாடிலாம் there was this consensus, right? Extraoral RCT you do, you treat the root apex, fluoride, no, nothing, you're not going to do anything of that sort, okay? Root கிடைக்குது அப்படின்னா just rinse it, put it inside, splint it, that's all you have to do. They have simplified it because it's not going to make any difference if you're going to do an RCT extraoral or intraoral. இப்போ பண்ணுறீங்களா, 2 வாரம் கழிச்சு பண்ணுறீங்களா, no difference at all. But of course you have to do an RCT. Only thing is you can wait, okay? நம்மளோட first goal is for the PDL to set in. அதுக்கப்புறம் தான் நம்ம பல்ப்புக்கு வர போகிறோம். So if at all you get an avulsed tooth, just put it inside. Closed apex-ஆக இருந்தால் 2 வாரத்தில் you will start your endodontic treatment. Again, if it's an immature apex, you're going to wait. So see, இந்த immature apexங்கிறது எவ்வளோ பெரிய விஷயம் பாருங்கள். உங்களோட பாதி நேரத்தில் வந்து you need not even initiate an RCT, you need not even initiate an endodontic treatment. The pulp will take care of its own. அந்த apexல இருக்க stem cells வந்து அவ்வளோ மகத்துவமானது, அதுவே எல்லாத்தையும் பார்த்துக்கும், நீங்கள் பெருசாக எதுவும் பண்ண வேணாம், ஓகே? Now இதுதான் வந்து எப்போவுமே the problem is primary tooth, right? ஒரு 2 வயசு குழந்தை வாயெல்லாம் ரத்தத்தோட ஒழுகிட்டு வந்தால் ஹவு எப்படி இருக்கும்? போச்சுடா இன்னைக்கு என்ன பண்ண போகிறோம்? I know permanent teeth is pretty easy, அதுவே டஃப் தான். எஸ்பெஷலி ஒரு 8 year 9 year old பொண்ணு, very tough. Boys are pretty easy. பொண்ணுங்க எஸ்பெஷலி 8-year-old 9-year-old I'm telling you very difficult to handle, okay. But I can feel that love. So next difficult situation on the primary tooth, okay. Simply because அது parents anxious ஆகுறாங்களோ குழந்தைங்க anxious ஆகுறாங்களோ இல்லையோ it makes us very anxious, right? The moment we see that. So and one more thing என்னன்னா we are not adequately informed what to do in primary teeth. அது ஒரு மேஜர் இஷ்யூன்னு வைங்களேன். பிரைமரி டூத் ட்ராமாவா எக்ஸ்ட்ராக்ட் பண்ணி தூர போட எப்படி இருந்தாலும் பல்ல முளைச்சிடும்ல. That is the usual thought we have among ourselves, right? Whenever there is a primary tooth, be it either caries, be it either non-vital tooth, trauma, ஐயோ primary tooth எடுத்து முதல்ல வெளில போடு, அது எப்படி இருந்தாலும் அங்கே பல்லு வந்துடும், எதுக்கு கவலைப்படுறீங்க? No, that's not the case, okay? So we have changed in that. So இதெல்லாம் உங்களுக்கு என்னன்னா தெரியும். Enamel fracture என்ன பண்ணும்? Smoothen the edges, uncomplicated, seal the dentine. Again, complicated crown fractures, whenever a pulp is exposed in primary tooth also, என்ன பண்றீங்க? We are only trying to save the vitality, okay. That is one thing which we all have to remember. We have to save the vitality. Now எங்க difference வருது அப்படின்னா crown root fractureல ஆரம்பிச்சுதான் we are having a difference. The guidelines changes from crown root fracture. முன்னாடி எல்லாம் crown root fracture in a primary tooth, extract it. Now no, don't extract, okay. What can you do? If the pulp is exposed, you do a pulpotomy, pulpectomy. Even if the root is exposed, what do? A pulpotomy, pulpectomy. Even if கீழே இருக்கிற எல்லா coronal fragment வந்து பயங்கர மொபைலா இருக்கு, crushed, usually in primary tooth you will see crushed injuries. If it is very crushed, it's not restorable at all. You do an RCT, you put the root inside, வெளியில இருக்க அந்த coronal fragments மட்டும் எடுத்துட்டு just suture the gingiva, okay. The gingiva மட்டும் suture பண்ணிடுங்க, root fragment will be left inside. Do not attempt to remove the root fragment also. So basic idea என்னன்னா whatever is left of the tooth, put it inside. Primary toothல ஒரு root fragment மட்டுமே இருந்தா கூட that is very helpful, okay. So for the other tooth to come out, okay. So see, in the patient வந்து, the patient came to us when he was 1.5 years old. இந்த மாதிரி தான் ஒரு situationல வந்தாங்க. The pictures are not that very clear. So இப்போ பாத்தீங்கன்னா 6.1 and 6.2 was avulsed. 6.1 was extremely mobile with lot of alveolar fractures, so we couldn't do much about it. But 5.1 வந்து there was a complicated crown root fracture. So நாங்க இதுக்கு என்ன பண்ணோம்னா we did a RCT for this tooth. ஒரு cap போட்டோம், we gave a Gropper's appliance, and the patient is quite fine actually. So the idea of doing this is, and the 5.1, see, when 6.1 and 6.2 is not there, why not 5.1 also? That will be the question, right? எதுக்கு அதை கஷ்டப்பட்டு அதுக்கு ஒரு RCT பண்ணி அதுக்கு ஒரு cap போட்டு. But no, whenever and see, that is next thing which I would like to say. ஒரு occlusion வந்து, whenever there is a malocclusion that is asymmetrical, that will create lot of issue when the child grows up. ஒரு symmetrical malocclusion, we always say, right, canine extract பண்ணா ரெண்டு பக்கமும் extract பண்ணுங்க. We do not want the malocclusion that is going to cross the midline or asymmetrical malocclusion. இதெல்லாம் விட better வந்து preventing the malocclusion. So this, any kind of primary tooth trauma is aimed at preventing the malocclusion that can happen later, okay. ஒரு சின்ன space problem in a primary tooth can create a huge amount of malocclusion in the permanent tooth. So இது பாருங்க, this is like I said, can you see how crushed the tooth is? So usually primary tooth இப்படி தான் நடக்கும். Can you see the fracture line extending into the root? So நாங்க என்ன பண்ணோம்னா whatever was mobile we extracted that. We did a pulpectomy பண்ணி, we did a short post here. Now that is that's another thing, short post. So post எல்லாம் primary toothல போடலாமா? Yes போடலாம், but that is a short post, okay. So this short post will not interfere with the eruption of the permanent tooth. அது ஹைட்டே அவ்வளவுதான், ஒரு 3 mm தான் canal குள்ள போகும். So that is just for your restoration. So that was a short post that was done. Then we did a strip crown for the patient, okay. So patient is kept under follow up. So the idea is, again we have to tell the patient subsequent trauma nadakradhukana chances adhigam in case of primary dentation, okay. The child keeps falling. So always keep that in your mind whenever you are doing treatment for the patient, okay. Tell them subsequent trauma nadandha ente kootiduvanga ena ulla na nariya panni vechiruken, dayavu seidhu ente kootiduvanga. You go to another dentist, they will not know what to do with that, okay. So always tell that to the parent, okay. You see usually இந்த அளவுக்கு அடிபடுதுன்னா அது கண்டிப்பா அடுத்து இன்னொரு 2 மாசத்துல இன்னொரு அடியோட வரும். So always remember that, okay. So see, இப்போ இந்த கேஸ் நீங்க எடுத்தீங்கன்னா, can you see again it's a crown root fracture, but there was nothing coronally, right? எதுவுமே பண்ண முடியல. So what we did, and the root fragment was also only so much. So what we did was we just left the root inside and we just sutured it. Now this patient also will be under follow up, okay. So this is the matter. So whatever is remaining of the primary tooth, you are going to keep it, you are going to preserve it, okay? So that is the lesson. Now root fractures, munadla extraction, ipa adhe mari da whatever I was saying, okay? Whatever is, if you can splint it, okay? நம்ம எப்படி permanent teethல வந்து root fractures splint பண்றோமோ அதே மாதிரி in primary tooth also you can splint it. But in case if it's very crushed, if you can't save the coronal fragment, extract only the fragment that needs extraction, put the remaining fragment back inside, or do not try removing it, just suture it back, okay? So adu appadiye resolve agum. As and when the permanent tooth starts coming out, it will start resolving, okay? Do not think it's going to get infected la illa, because it's way inside, nothing is going to reach it, okay? So root fracture, this is it. Now இதெல்லாம் உங்களுக்கு தெரியும், I think, I mean whatever is there, concussion, subluxation, just follow up, okay? Now extrusive luxation, அதுவும் வந்து once upon a time we were extracting the tooth, because we felt that the tooth வந்து லூஸா இருக்கு. எப்போ அதை எக்ஸ்ட்ராக்ட் பண்ணலாம்னா, whenever you feel that even after I splint there is a chance that the child might ingest the tooth, அந்த மாதிரி ஒரு situationல you can extract it. Other than that, if it is not interfering with the occlusion, it will even spontaneously it will come back to the occlusion, okay? Extrusive luxation in primary tooth, it will not bother, it will spontaneously come. Only if it is more than 3 mm, or if you feel that okay na idu splint panna kuda vandu and kolanda mulingidum appadina, you will start extracting the tooth. Intrusive vandu spontaneous repositioning, there is no treatment for intrusive luxation at all. Na munadi la nama if it's, you know, if it's bothering the permanent tooth, not bothering the permanent tooth, yes, you can actually take a radiograph to document that okay idu permanent tooth pakkathula iruka, permanent, maybe the radiologist can explain you better. If it is elongated, if it is foreshortened, how it would be, like if it's near the primary tooth, permanent tooth, it's away from the permanent tooth. But what I say is none of that matters, okay? Intrusive luxation, allow it to come down. You need not go and just because in the radiograph la vandu adu permanent tooth pakkathula irukku, doorathula irukku, adanaala naan poi eduthupen, don't know heroism at all. Intrusive luxation, wait, it will come out, okay? Once it comes out, it will be non-vital, you can do a pulpectomy on that, okay? So similarly lateral luxation adhe mari dhaan. Minimum displacement, there is no need for you to even splint it, automatically aduve adjust aidum. If it is more innu konjam mobile ah irukuna, you can splint for 4 weeks, okay? Avulsion, yes, ipo varaikum do not reimplant da solranga, though there are a lot of studies on reimplanting the primary tooth. As of now, do not reimplant, okay? So this was a case of intrusion. Now if you see radiographically paatha adu vandu permanent tooth pakkathula irundha mari dhaan irundhuchu, but again we did not attempt for any extraction, so the tooth came out on its own. If you see the next picture, enga radiograph kuda edukka mudiyala, that was a very poor radiograph, but even with that we just left it as such, just thinking the guidelines dhaan kadavul appdi nenachittu anga vittutom. Can you see how beautifully the tooth has come out? And if you see in the idella vandu we will not even attempt for any root canal procedures, okay? We will just wait. Primary tooth la adudha, even if it is discolored, you need not attempt for any root canal procedures, okay? Only if there are visible signs of non vitality you can go and touch the primary tooth. That's the beauty of primary tooth. Now extrusion, spontaneously it will get adjusted, okay? If you see, nothing was done for this patient, okay? Extrusion oda vandirundanga, we just left it. Now you can see the permanent tooth coming out. Permanent tooth is coming out, okay? So just keep the patient under follow-up. Lateral luxation, now this was interfering with the occlusion, so we decided to splint it. There was also an alveolar fracture for this patient. Usually lateral luxation la irukum, so we splinted after 2-4 weeks, okay? So avulsion, yes, as I was saying, avulsion as of now is contraindicated. The guidelines padi you are not supposed to reimplant an avulsed primary tooth, okay? So maybe the guidelines would change. So next is follow-up, okay? Romba important vandu follow-up. As I was saying, in all the dental trauma, follow-up is the key, okay? Now these are all the pitfalls in follow-up, okay? I'm not going to explain in all this, it's something which we all know. Kupda matom, kupta patient vara matanga, vandalum you will not have adequate time to do a proper assessment. Baseline la neenga enna assessment panninglo adhe da at every follow up you need to do, okay? So make sure you do that, okay? So poor documentation, so these are all the pitfalls in dental trauma, and I have also given like how you can manage it. Basically you need to have a protocol functional in your clinic, okay? So a trauma patient vandanga, what you should have a chart that is ready, or clinical examination chart irukano, adile follow up details irukano. So each time you have to have somebody call up the patient, to see how he is. Okay, அவங்களா வந்து ஒரு கம்ப்ளைண்ட்டோட வரதுக்கு முன்னாடி நீங்களே கூப்பிடுங்க. கூப்பிட்டுட்டு every time the patient comes in, there should be a monitoring of the pulp vitality, radiographic examination இருக்கணும், clinical examination இருக்கணும், soft tissue examination இருக்கணும். All these things should be done without fail. Okay, only then you can have a good trauma practice. Okay, so either to make things easier, இது வந்து IADT website. If you go to IADT website, now you have 2020 guidelines. Can you see இதெல்லாம் எல்லா languagesலயும் it is available, all these guidelines. It's even available in Tamil. இந்தியாவில் 2 languages தான் இருக்குது, ஒன்று ஹிந்தியில், இன்னொன்று தமிழில் இருக்குது. ஸோ Korean, Portuguese, you can download in whatever language you want. I know you can stick it to your, you can get it, downloaded in Tamil so that even your clinic attenders know what to do. Okay, வந்தானே யாரை கூப்பிடணும், என்ன கூப்பிடணும், all that they will know. So basically that is, it's available in the website. Okay, it makes your thing. And there is also another app called Tooth SOS. So அந்த ஆப் கூட நீங்கள் டவுன்லோட் பண்ணிக்கலாம். You can, this it handy-ஆ இருக்கும், உங்கள் ஃபோன்லேயே இருக்கும், என்ன பண்ணும் எது பண்ணும், it will be there. So yes, and these are the take home messages. Okay, so whatever I was saying, act fast, diagnose correctly. Okay, so first thing is follow guidelines, monitor long time, and if at all you have a patient who is involved in sports, நீங்க போடுங்க all the sports related injuries prevent பண்ணனும்னா mouth guards. Okay, so introduce mouth guards to the children. Okay, so teamwork, have a robust team with you. உங்களால முடியாதுன்னா start referring. Okay, so you know him, right? இதுவும் தெரியாதுன்னு சொல்லக்கூடாது. So what is the thing about Annamalai? That's Annamalai only. அது ரெண்டுமே அண்ணாமலை தான். ஆமா ஆமா ஆமா. என்ன நடந்துருக்கும்? So இது இந்த மூவி ஜவான். So we all love the coming back moviesலாம் நமக்குலாம் ரொம்ப பிடிக்கும்ல, ரொம்ப கஷ்டப்பட்டுட்டு இருப்பாங்க, suddenly hero comes out, we all love them, right? So this is one thing which I want to tell you, that teeth can also have a comeback. Okay, so this is something which எங்க போனாலும் நான் சொல்லுவேன், do not over treat. Okay, pulp வந்து ஒரு பியூட்டிஃபுல்லான hero that is right there, so do not over treat, allow the pulp to heal on its own. Okay, so that's the most important take home message. So thank you.